Adhesive skin closures may be used for wound repair to approximate the edges of a laceration or incision until the healing occurs. They consist of sterile strips of hypoallergenic tape available in different lengths. They are used when not much tension exists on the skin edges. The advantages of adhesive skin closures is that they eliminate the need for sutures and a local anesthetic. They are easy to apply, and they have a lower incidence of wound infection than sutures. The medical assistant is frequently responsible for applying adhesive skin closures in the medical office. The medical assistant will show you how to apply adhesive skin closures to a child with a superficial incision of the forearm. Before proceeding, wash your hands with an antimicrobial soap. Next, assemble your equipment. You will need clean disposable gloves, sterile gloves, antiseptic solution, a surgical scrub brush, antiseptic swabs, tincture of benzoin, a sterile cotton-tipped applicator, and the adhesive skin closures. Greet the patient and introduce yourself.
Hi, my name is Kim, and I'm going to be your medical assistant for today.
Identify the patient and explain the procedure.
I was born on March 7th.
Okay, Michaela, your doctor wants me to put on some skin closures for you so it'll help your wound heal.
Okay.
Position the patient as required for application of the strips. Make sure you have adequate lighting to perform the procedure. Apply clean gloves. Inspect the wound for signs of redness, swelling, and drainage. Chart this information in the patient's record after completing the procedure. Gently scrub the wound using an antiseptic solution such as betadine and a sterile gauze pad or a surgical scrub brush. Clean at least 3 inches around the wound, making sure to remove all debris, skin oil, and exudates. Allow the skin to dry or pat dry with gauze squares. Apply antiseptic to the site using antiseptic swabs such as betadine to decrease the number of microorganisms in the wound. Apply the antiseptic from the top to the bottom of the wound, working from the center to the outside of the wound. Use a new swab for each motion. Allow the skin to dry completely to ensure adhesion of the closures. Change gloves as needed to maintain medical asepsis. Tincture of benzoin helps the strips adhere to the skin. If dictated by the medical office policy, use a sterile cotton-tipped applicator to apply a thin coat of tincture of benzoin to the skin parallel to each side of the wound. Do not allow the tincture of benzoin to touch the wound. Allow the skin to dry. Remove your gloves and wash your hands with an antimicrobial soap. Open the plastic peel-apart package of strips by grasping the flaps of the package between your thumbs and bent index fingers. Pull the package apart. Peel back the package until it is completely open. Lay the opened package flat on a clean, dry surface. The inside of the package serves as your sterile field. Apply sterile gloves. Fold the card of strips along its perforated tab and tear off the tab. This exposes the ends of the strips, making them easier to grasp. Peel a strip of tape off the card at a 45-degree angle to the card. Check to make sure the skin surface is dry. Position the first strip over the center of the wound. Secure one end of the strip of tape to the skin on one side of the wound by pressing down firmly on the tape. Stretch the strip in a transverse line across the incision until the edges of the wound are approximated exactly. If necessary, use your gloved hand to assist in bringing the edges of the wound together. Approximating the wound exactly facilitates good healing and minimizes scar formation. Secure the strip on the skin on the other side of the wound by pressing down firmly on the tape. Apply the second strip perpendicular to the incision on one side of the center strip. The space between the strips should be approximately 1/8 of an inch. Apply a third strip on the other side of the center strip at a 1/8 inch interval. Continue applying the strips at 1/8 inch intervals until the edges of the wound are approximated. This spacing keeps the wound edges together, but also allows for drainage of the wound. Apply 2 closures approximately 1/2 inch from the ends of the strips and parallel to the wound. This laddering effect redistributes the tension and assists in holding the strips firmly in place. Remove your gloves and sanitize your hands. Instruct the child's parent in wound care. Provide written wound care instructions along with your explanations. Tell the parent to keep the child's wound clean and dry and to contact the office if signs of infection occur. Inform the parent that in approximately 5 to 10 days, the skin closures will loosen and fall off on their own. Ask the parent if she has any questions. Have the parent sign the instruction sheet on the appropriate line. Witness the parent's signature by signing your name in the appropriate space on the form. Include the date. Before the parent leaves the office, make a copy of the instruction sheet. Give a signed copy of the wound care instructions to the parent and file the original in the patient's medical record. An instruction sheet signed by the parent provides legal documentation that wound care instructions were provided. Chart the procedure, including the date and time, the appearance of the wound preparation, the number of strips applied, the location of the wound, the care of the wound, and the patient's reaction. Chart the verbal and written instructions you gave to the patient concerning wound care.